The CTS allows corneal cuts of a precision of about 30 micron. It is about matching precision between donor and recipient, which is accomplished by transferring the donor button radii as measured on the operating table to the recipient. The obturator is needed to eliminate diameter differences between donor and recipient up to 8 diopters in the normal case. The no-obturator trepanation moves the trepine rectangularly or straight. Thereby is an inevitable generation of cylinders, no matter if the trepine may be the same for donor or recipient. To take advantage of the obturators, first you have to measure the donor cornea radii. After cleaning of the surface of the cornea, fill up the donor shell to about half, then turning it over and filling it completely with BSS. Then, while keeping the surface wet, the radius is measured with an electronic ophthalmometer, for instance KM500 of DMEK. Use the mean of the two radii from the readout. Now choose the respective obturator that fits the donor's cornea. The next step is to take the trepine, in this case with 8 mm diameter, and check under the microscope if it's sharp or not. To do so, focus on the cutting edge, and if you see a reflection, it is not sharp at this point. As you can see here, we have a little point that is not sharp, but for a penetrating keratoplasty, the trepine fulfills the requirements. To assemble the trepine core, the trepine together with the obturator is mounted. And now the trepine core can be screwed into the CTS trepanation guide. Now the trepanation system is complete. To find the zero position of the trepine, you look on the edge of the trepanation system and adjust the depth of the trepine until you see the trepine. Now set the trepine back and mark the position as start position. The CTS trepanation system is now ready to use. To cut the donor cornea, you have to assemble the anterior chamber bench. The anterior chamber bench is hooked on to an infusion bottle with BSS and mounted to a 3-way stopcock. The tubing is filled with BSS and the CTS central plug is inserted. Make sure that no air is inside the system. The donor button is then positioned over the central plug, and the fixation ring plate is either 11 or 12 mm, depending on the size of the cornea. To position the donor button without air inside, add BSS through the syringe while positioning. At this moment, the CTS anterior chamber bench is connected to the syringe over the 3-way stopcock. The CTS tensioning screw is screwed on tightly. The 3-way stopcock is now ready to be opened for the infusion. The infusion simulates the intraocular pressure on the anterior chamber bench. The pressure can be adjusted by the bottle height. The pressure is then measured with the surgical tonometer. If the pressure is too high, the applanated surface is too small. If the applanated area is too big, then the pressure is too low. Now the cornea is marked with Gentian violet. The anterior chamber bench is now set up and ready to use. To perform a cut with a CTS trepanation system, there are two mechanisms. If you spin the upper screw, the depth of the trepine is adjusted. If you spin on the lower ring, the trepine is rotated. This is to maintain an even cut without squeezing of the tissue. One rotation of the upper screw means 1 mm of cutting depth, so each mark means 100 micron. So to perform a cut, we are setting the depth of the trepine at 100 micron deeper and then rotate the trepine one turn. This is repeated until the marks start to rotate. That's a sign that the cornea is cut in 360 degrees. Keep in mind to turn off the infusion before disconnecting the trepanation system of the anterior chamber bench. The cut of the donor cornea is now done. Make sure to change the obturator for the recipient side. The donor button may be kept in BSS or in the transplant solution. For the patient's side, mark the cornea with Gentian violet and assemble the CTS suction ring by inserting the CTS vacuum ring insert and connect it to a pump. To connect the suction ring with the recipient's cornea, start the pump and set the suction to 800 millibar. Now close the tube so the suction increases. Where the tube is closed, the suction ring is positioned on the cornea. Now release the tube so the suction starts. The eye is now fixated without increasing the intraocular pressure. The CTS trepanation system can now be connected with the new obturator to the suction ring. To perform the cut, the same steps as on the anterior chamber bench are performed. To sew the donor cornea in, the use of the double-running anti-torque suture is highly recommended.